Hi everybody, welcome to my channel, Grey River Acupuncture and Healing. My name is Jordy and I'm an acupuncture student studying in Nova Scotia. I'm in my third year doing my clinical hours where I'm actually practicing acupuncture on students as well as patients from the public who are paying at a reduced cost, to support our learning. And in this video and in one of my previous videos, I'm doing a case study review. So last week we did a case study review looking at a, like a deficiency-based picture that led to insomnia. And this week we're looking at a deficiency and excess picture that leads to back pain, as well as headaches, anxiety, stress. So it's going to be an interesting case today. We're dealing with we're helping treat a 32-year-old male who works a regular early morning day job of being an accountant or an account bookkeeper, and then in the evenings, occasionally and on weekends, works part-time at in the food industry. So this person has recently come to student clinic only this spring, and their first time ever receiving acupuncture or treatments from TCM modalities was the week before I got to see them with another student. And when they came in the first time, they were having a lot of sleep issues as well and energy level issues, which when they came in to see me this week, they still wanted treatment for their back pain and for their anxiety and headaches and stress, but they also wanted to let me know that their sleep had improved from the week before, and they had received improvement in their back pain as well, which is great because that means I could kind of piggyback off of what they had already diagnosed and what my fellow student had prescribed as a treatment plan for acupuncture points. So let's go through the intake, and I'll talk about the different questions I asked and the answers that the patient gave. We'll go through the tongue and pulses, as well as the diagnosis, the treatment principles, and then the point prescription. So thank you so much for liking, sharing, commenting below, and subscribing to my channel. I appreciate all of your love and support. If you have any questions or comments, I'd love to hear from you in the comment box below. You can also shoot me an email, which you can find in the description box of this video. Keep in mind I am a student, I may make mistakes, but the whole idea is not to be like perfect in my diagnosis and all that. It is signed off by supervisors each time I go through these intakes, and luckily with this client I've got a couple different intakes to show a progression of how their situation has improved and what we've changed with each week's prescription plan. So that's another benefit to this video today. Chief complaint is the whole back pain. And when I asked them to describe the back pain, they do have lower back pain, which is dull. When you have dull pain, that's an indication of a deficiency-based pain. In the lower back, it can be kidney deficiency or spleen deficiency as well, spleen qi. Spleen qi because spleen controls the muscles, and there's a lot of muscles in the lower back. It's mainly just muscle there. Spleen, kidney also being, governing the lower part of the back, and the kidneys being in the lower part of the back is another sign of kidney deficiency as well. So that right off the bat, we have a pretty good idea of what we're dealing with here. Spleen and kidney deficiency patterns. He's described that there's relief when he twists his back to crack along the spine. And it is along the spine that he's feeling most of his pain. He does feel some lower back pain because he sits at a desk all morning. But he said that the pain in his spine seems to be worse when it's hot outside with high temperatures. Um, and he does have to take Metro Transit to commute to and from, work and wherever else they like to go. So he is subject to being in the heat and then also the extreme air conditioning that they have on the Metro Transits as well. So knowing that temperature affects the spine pain as well indicates that there might be some type of either excess heat condition within the body, within the blood, within the bones, within the spine, or in the meridian along the spine, which is the due meridian or the governor meridian vessel. The due meridian is along the spine. It runs from the base of the spine all the way up to the top and then down over the nose and into the roof of your mouth. So the other meridian on the front of the body, that's on the front body down the center line, is called the Ren meridian, and that also connects down at the bottom at the base of the spine, and then connects at the root of the tongue here. So if you actually press the tongue to the roof of your mouth, you're creating a full circuit between these two meridians. But that's just a side note. It's interesting because the due meridian is the yang meridian. It has a special point called due 14, which is at C7 along the upper spine, upper thoracic, and the bottom of the neck there. So at that point is where all the yang meridians intersect. So yang meridians being the Fu meridians. In Zhang Fu theory, we have the Zhang organs, which are organs like the liver, the heart, the spleen, the lungs, the kidneys. They all, are the computer hubs. They control the processes within the body. They control the Fu organs, which are the digestive organs. So that where the Zhang organs are dealing with essential substances like blood and qi and jing, which is your essence, your DNA, your reproductive energy. And we also have the body fluids, being the four essential substances. So where the organs are commanding those essential substances and making sure they go to all the other organs and they circulate throughout the body, they also control a paired Fu organ. These Fu organs, the digestive organs, pair up one organ with each Zhang organ. So it's interesting. That's a bit of foundation theory for you, but essentially all 6 of the Fu organs, which are digestive, which are more active in nature, they're processing things from the outside and excreting them back out after they've been pulling all the nutrients and transforming the food into usable qi and nutrition. So because they are more active and dealing with using a lot of qi, using a lot of energy, they're considered the yang organs. And when it comes to different parts of the body, we've got the front and the back of the body, we've got the sides, we've got the top and the bottom. Each of those different areas are more yin or yang in nature. Well, the back is considered the yang side of the body, where the front body is considered the yin side. And because the due meridian is along the back spine, it's considered the yang meridian, the most yang of meridians. And we also have all of the organs, all of the meridian pathways intersecting at the top of the spine, right at the bottom of the cervical spine and the top of the thoracic at C7. And because all these organs intersect there and all this yang energy is moving through that part of the body, heat can be addressed by cooling off that, or like reducing that area with a with an acupuncture needle, or by doing gua sha around that area to release the heat, or fire cupping as well. Um, so a lot of people use that point to deal with true heat in the body. Um, so it's interesting. We know with this back pain, with the spine pain being a temperature, it's that the pain is triggered by higher temperatures. We know that it is either a true heat because of it being connected to the DO14 part of the spine, or it's also considered a deficiency-based heat, which is when we don't have enough cooling yin to lubricate and almost work as a coolant within the body. All the body fluids, the blood, everything that yin is associated with, and when we don't have enough of that cooling yin, the regular heat in the body becomes pathogenic simply because it's not being cooled off and regulated. So that's a deficiency-based heat called false heat. So I believe, and I'll explain why throughout some of these cases, that he has to deal with external invasions of heat from the temperature outside, and that triggers an excess heat condition within the spine. And I also believe he has, because of his kidney and spleen deficiencies, qi, blood, and yin deficiencies within his body. So there's not enough cooling blood. There's not enough, going through, in that area along the spine. There's not enough cooling yin going up to the heart from the kidneys, and there's not enough qi to keep the external pathogens from invading. Particularly around that area is also a couple of acupuncture points called bladder 12, which are on the other side of the spine. That's another area that external wind can easily aggravate that area, and temperature issues can arise from that as well. So it's different because this type of back pain is not caused by extraneous, movement, or it's not caused by stagnation, where injuries may have caused the stagnation or something like that, or deficiency-based pain. So, long story short, we have a spleen qi deficiency, a kidney deficiency, a little bit of yang, a little bit of yin, because of the lower back pain and because of the yin deficiency based heat. And we also have this temperature dynamic going on, which deals with yin and yang up in the spine as well. So when asking other questions about their health, he's described having frequent headaches, which have been lessening after the previous week's treatment, mostly on the right side, and they also get triggered by heat. So there's another sign there. When headaches are on the side, it means they're dealing with the gallbladder meridian, and the gallbladder meridian gets stagnant or full of heat when the liver is either stagnant or rising. Heat's rising from the stagnation in the liver, and a lot of times stagnation in the liver is caused by not enough qi from the spleen or not enough blood as well. When the liver's not fed, it gets unhappy, and then the qi starts not moving as well in the body, because the liver is the governor of qi. Well, it governs qi. The lung governs qi as well, but it moves qi. The liver moves qi. So anyway, starting to get a little bit off track here, but I want to give you as much information in this video as possible because we are students benefiting from these videos. That headache, could be a wind heat type of headache where it's one-sided. It could also be due to the fact there's not enough qi and blood filling up the meridian up there. And, probably a combination of both, the wind getting in and because there's not enough qi and blood to kind of like counteract that external invasion. So it's an aching type of pain. And they also came in for sleeping issues. They said they had improved since the last week. Usually after work, when they get off around 3 p.m. or actually 1 p.m., they have to go right to sleep. And then they wake up at late in the evening, and then they're awake until 4 a.m. then when they go back to sleep again. So it's a completely dysregulated sleeping pattern where they're working in the morning, sleeping throughout the day, awake throughout the evening, and into the night and into the morning, and then going back to sleep again for a short period of time. So now they actually are awake until 9 p.m., staying awake after work, and then waking up at 7 a.m. And the main treatment principle that helped improve the sleep, which I could see from my other fellow student, was treating the kidney health. And giving their spleen a bit of a chi boost as well. So the kidneys are the house of yin and yang. They deal with the temperatures as well as the states of the body. And when you see like a whole night's sleep routine off by such a dramatic difference, it's a pretty clear sign that is to deal with yin and yang imbalances. So it was a good thing that fellow student caught that, because now he's got better sleep. He does struggle with overthinking and with stress and anxiety. Anxiety related to the heart, overthinking related to the spleen, stress related to the liver. And we do see some of the pulses reflecting that as well. So it's great to hear that their sleep has improved. We're going to continue doing some of the treatment principles that the past student has done. Their appetite is also good. It's regular. They're eating a lot of junk food and pre-made meals, though, however. They do eat a good breakfast, they with tea and a bagel and fruit. And sometimes they eat rice and stew after work and skip the evenings. So overall, it's like some good food, some bad food, but they're not eating 3 meals a day. They're skipping the supper time meal. And in the morning when they're having their breakfast, they're eating fruit, but they're also with their tea and bagel, but they're also eating a smoothie with leafy greens in it. Which contributes to their bowel movements every morning being loose, because the cold smoothie with cooling vegetables in the smoothie are all very difficult to digest for the spleen every day. So that leads to a looser bowel movement because the spleen can't really control the digestion as well. And it also leads to having green stool as well, because it's undigested spinach and all of that. So we can see there from the bowel movements that there's a spleen qi deficiency going on. We can see from the eating habits that they're not treating their spleen in the way that we should, with eating 3 regular meals a day plus snacking, and making sure that we consume warmer foods and easy to digest foods that are cooked and not raw. And it doesn't seem like they're getting very high levels of qi from their food as well. Maybe they're using more qi than what they're getting in to digest it. With the urination, it's good. It's regular. It's not every hour. It's just a few times a day, and it's white and clear. They do urinate more often in the beginning of the day because they're drinking a lot more fluid in the beginning of the day. Their eyes, when asked about anything to do with their eyes, everything was okay there, as well as their hearing and their ears. They didn't have any issues with their lungs, except for when they were younger, living back home in a hotter climate. That it was a hot and dusty climate, so their sinuses were always clogged. Growing up in that climate, so when they moved to Canada, all of those sinus issues went away. Looking at their tongue, they had a pink tongue. It quivers. So the pink tongue being a good color, a normal color. It also quivers, which means the muscles are not being controlled completely by the spleen. It has scallops on the side, which means that the spleen chi is not controlling, like the tongue is swelling out, and the teeth are biting the sides, so that means chi is not controlling body fluids, which is transformed and transported and controlled again by the spleen. And it had a white coating, so we're definitely seeing a spleen chi deficiency tongue, with some cracks and with a slight crack in the stomach spleen area and back in the kidney area as well. The heart pulse was faint and deep, the liver pulse was soft, the kidney pulse on the left side was faint. So this is indicating there's not enough blood, or kidney yang, or kidney qi. On the right side, we had the lung pulse was fast, which indicates perhaps a heat, pathogen, an external pathogen, wind, heat specifically, which we talked about, causing some of the headaches, and also the temperature issue causing the spine to be painful as well. The spleen was deep and faint, and the kidney was deep and empty. So, these pulses indicate that the qi is also deficient in those organs. So overall, the diagnosis was there was a lot of obvious signs of the spleen qi deficiency. There were a lot of obvious signs of the kidney qi deficiency. We still don't know completely if it's only just a wind heat invasion in this that's particularly bothering them due to a lack of blood and qi being produced from the spleen and the kidney, but we didn't see too strong of a sign of blood deficiency in his case this week. Especially where his sleep is just improving. It was more so a yin deficiency that we were seeing as being like the biggest thing that was being corrected from the week before. So we went with points that were similar to what the previous student had chosen. We went with kidney 3, which helps tonify the kidneys, kidney 6, which helps tonify the kidney yin. We went with spleen 3 to tonify the spleen, as well as spleen 6 to tonify the liver, spleen, and kidney, particularly the yin part of those organs. We went with stomach 36 to tonify qi and yang, lung 9 to add some cooling yin to the lungs, as well as to tonify the lung. And we chose liver 8 to help tonify blood. We also chose Shen Men as an sympathetic point, 2 points in the ear, using auricular acupuncture. Shen Men to help calm the spirit and help with the anxiety that they mentioned, and the sympathetic as well to get them out of fight or flight mode, get them out of the stress that they're dealing with. We reduced SI3 and bladder 62, which are a combo pairing that open up the du, which is the governing vessel, which is along the du meridian, along the back of the spine, as well as it opens up the governing vessel and another important extraordinary vessel. I forget which one. But ultimately this double combo opens up the back, particularly along the spine and particularly along I think the yang motility vessel, or the yang linking vessel is what it deals with, the yang linking vessel. So that's kind of like a crisscross along the back of the body. This is a really useful point combo because you don't actually have to use points in the back to treat the back. So we're helping reduce the pain and the stiffness along the back. We chose lung 7 to help deal with the wind heat and get that wind out of the lung meridian. And we also chose do 20 at the top of the head to kind of just like bring the yang down, bring the excess thinking, the overthinking down. It's a point that when reduced can just kind of move the yang back down, kind of control the yang. And it also helps deal with heat as well. So that was very interesting. The next week they went and saw another student, the same student that they saw before me the week before. So he's kind of going back and forth each week between the two of us. There wasn't too much change in their treatment plan and in their diagnosis and intake, except for the fact that they were still getting the lower back pain, still getting the spinal pain, having difficulty falling asleep now. So their sleep is still drastically improved, but they're overthinking, which is that spleen qi deficiency. When they're trying to fall asleep, sometimes that can indicate a bit of a blood deficiency as well. If we looked at the tongue and pulses, the tongue stayed the same. The pulses improved. They went from being, deep and faint and fast and soft to being normal for most of the pulses, even though we still had weak pulses in the kidneys, one of the soft on the yang side, fast on the yin side. So just a couple of small details like the fast pulse on the kidney yin side, as well as knowing when temperature rises, you get the joint discomfort. That we're not only dealing with kidney and spleen qi deficiency, but we're also dealing with the yin deficiency. So they went with the same points that I went with last time, but did a little bit of a different approach with heart 7 and heart 3 to help with heart blood, and also to help calm the spirit, the anxiety. They didn't use a strong spleen 3 or liver 8. So that was interesting. They didn't use spleen 3 or liver 8. So then going into the third week, when he's coming back before, his back pain is not as bad as it's been improving each week. His anxiety is still there. He wants to treat the anxiety. His sleep is much improved. His bowel movements have improved. They're back to a regular color. They're more formed. So we're seeing how the kidney yin, the kidney qi deficiency, and the spleen qi deficiency are all improving. But what was interesting is that the tongue was pale orange this time, the whole tongue, which indicates blood deficiency. And the pulses were back to being deeper, and in this case the heart pulse was thready, the liver pulse was fine, the lung pulse was short, and the spleen pulse was fine. So we don't have any external pathogens there. We kicked that out 2 weeks before. But we're seeing that as we've tonified qi and yin continually for 2 weeks now, that we're seeing a bit of a blood deficiency kind of, knocking at us, trying to get our attention with that orange tongue. So I went back with the same treatment plan that I did before, by having the spleen 3 and the liver 8, along with the other points I mentioned earlier, and also moved blood was spleen 10, and I kept the heart 3 point that the student had used the week before, because that's good for blood as well. And I also used the Shen Men point instead of in the ear, instead of using heart 7. So it's very interesting, that heat can cause the discomfort and pain in the spine, and that the heat can also be from external pathogens, which it was 3 weeks before, but there was that underlying condition of the yin deficiency, which is also, once treated, we can see that the underlying condition is the blood deficiency, because blood deficiency usually starts before you get the yin deficiency, unless the kidneys are really taxed. And that blood deficiency comes from the spleen qi deficiency, because the spleen's not making enough qi in blood. Okay, so you peel back these layers with each treatment, I guess is the point I'm making. And he's seen a lot of improvement with just 4 weeks of treatments. Very simple treatments as well. We're not breaking the matrix, so to speak, with all these points. And I do believe that if we were to keep treating this patient, that we might treat them on a more mental emotional level, now that we've kind of balanced some of their their sleeping habits, now that we've given them more information about how to eat better to support a healthier spleen qi. And because now they're kind of mentioning anxiety as their biggest thing when they're coming in first. So we're going to be, approaching it from a blood and at angle, tonifying blood, and also just kind of, working on the heart, working on the kidneys, and continuing to boost the spleen. Anyway, this is what I've got for the treatment plan and for the intake and all that today. I hope you enjoyed this conversation, or this, me talking to you, I should say. It's a lot of information, as you can see, even with me, when I'm trying to relay these thought processes to you. I could just read everything word for word on these forms, but it's when you're doing an intake, when you're listening to each of the things they say, you do have a bit of a conversation running in the back of your mind of like, oh, that's spleen qi deficiency. Oh, that's blood deficiency. Oh, that's kidney yin deficiency. And you start seeing you just start parking these little red flags you get in your mind until you get more of red flags in the same area. So by the time you're done listening to the consultation, and before you even get to the tongue and pulses, you should have an idea of what you're expecting. The tongue and pulses just confirm things or let you know that there might be something even deeper going on. So, as I'm telling you each of the different things we've asked about, I wanted to explain some of the foundational theory behind some of these things, because that's what's quickly running through your mind as you are listening to the intake. And that's another example, as well as, in this case, we didn't get too many details from the patient. They weren't a big talker. They didn't have too much to complain about. They didn't have too many symptoms of things in their day-to-day life. So you had to be really, aware of what they were talking about. And with not very much evidence to go by with some of these theories that we had formed. So we kind of had to approach it from, a little bit of a different angle each week until we really could see what was going on. And also seeing improvement anyway throughout those weeks. So it's a delicate balance of like listening and not making any assumptions and not jumping to conclusions, but also you want to be making some conclusions in your mind and just kind of letting them be there until you get the full picture towards the end of the treatment. So I don't know which is more important. It's kind of a juggling act there. That's for sure. All right. That's what I've got for today. Thank you for being here, and I'll see you again soon.